in a less embarrassing environment, example, the bathroom at the drinking fountain or while running an errand. Provide a private area, the nurse's room or resource room, where the student can go to calm down and release tics or obsessions. Tourette'sAction.org gives other actions you can take as a teacher. There are many simple changes that can be made in the classroom to support children with Tourette syndrome, including avoiding seating arrangement where tics will cause distractions, such as in the middle of the row, and offer short breaks if the child is ticking. Also, if the child is not using their energy to suppress tics, they may be more focused. So be very accepting of their tics so that it decreases anxiety for the student. Seating children with Tourette's at the front of the classroom can enhance attention, but make sure it is in a place where their tics are not as noticeable. You can modify or simplify task requirements because some things take a lot longer with children with TS. Do not discriminate work on the basis of handwriting. Tics make writing difficult. Also distribute instructions rather than requiring children to copy long instructions. Ask parents if their child is on medication, as this may cause side effects like sleepiness and lack of energy. The transition from year 6 to year 7 can be particularly challenging, so teachers may need to require additional planning and support. Teachers should also pair students with supportive and understanding buddies that are accepting of their Tourette syndrome. You should have effective and clear communication between school and home, bearing in mind that symptom severity may vary in different environments. Schools should ensure that individual education plans take full account of a pupil's Tourette syndrome. Teachers should also eliminate unnecessary materials from desks to avoid distractions, but permit students to fiddle with specified objects. Aids such as scribes, rulers, laptops, visual timers, grid paper, calculators, organizers, and visual diaries can be very helpful for students with TS. You should also allow the use of worksheets that require a minimum of handwriting for TS students. You can also set up work contracts between teachers and students. These can outline particular expectations and provide clearer goals. Tics can be typically worse at home than school, and completing homework can be especially hard as they are often exhausted from having suppressed or disguised their tics all day at school. An example of a teacher helping a student with TS comes from Susan Connors from the article Catalog of Accommodations for Students with Tourette Syndrome, Attention Deficit Hyperactivity Disorder, and Obsessive Compulsive Disorder. This student tapped the pencil on the desk as their tic, and the teacher came up with a truly creative way to accommodate the tapping. They taped a sponge on the desk so that the tapping of the pencil would not distract other students from working.